Good afternoon. We are team number one, and we're going to talk about rheumatoid arthritis. So, first of all, we would like to talk about the barriers for working in multidisciplinary teams. So, the first one that we could identify was the economic burden, because as we know, rheumatoid arthritis is a disease that needs a lifelong treatment. So, this represents that if they get involved like in a multidisciplinary team, they have to invest more money into different appointments, and this could like really harm the economic aspect of patients. Another one is the lack of knowledge, because some healthcare professionals may not really know important information about implementing other areas in the treatment of their patients. And this can be like an example when a physician really knows a lot about the pharmacological treatment but doesn't really know about the benefits of an adequate diet, and they do not give like advice regarding this specific topic, or they do not refer their patients with a nutritionist. Another one is communication, because as we know, in multidisciplinary team, we have to pursue a single objective. So maybe healthcare professionals may find it difficult to find a moment to get together and really discuss the specific objective they are gonna pursue. Another one is that patients may lack the time for really getting to attend to several appointments. Another one that is related to the economic burden and to the time is the geographical location, because in a study we checked, it said that patients prefer when their healthcare professionals are near them. So if they are like far away, maybe they won't be able to attend to different appointments. And another one that is really important is the professional stereotypes, because maybe some healthcare professionals like tend to underestimate other specialties or other healthcare areas, and they may like deprive their patients from this specific care, and that could be really helpful in improving their quality of life.
So the nutritional care in different disciplines. First, we're going to have psychology. It is important to have psychological well-being to adhere correctly to specific dietary modifications and changes in lifestyle. For example, cognitive-based therapy showed better results in diet regime adherence, and also in changing the state of change, improving motivation, decreasing anxiety, and lifestyle changes. Then we have medicine. In medical care, it is important to treat rheumatoid arthritis patients adequately, not only with drugs, but also with the correct management. In clinical practice guidelines, we can find some dietary recommendations. For example, the IMSS guidelines recommend vitamin D and calcium, and also food-drug interactions might modify the nutritional needs. For example, methotrexate has interactions with grapefruit, fish, and folic acid. Finally, we have biosciences. The development of new evidence-based dietary recommendations requires research. For example, the effect of high fatty acids of certain types of diet, and compare them through different types of studies can generate innovative data and information to help to create these guidelines for nutrition. And nutritionists and bioscientists can also collaborate to discover the mechanisms of how they affect each other.
Now, lastly, speaking about the nutritional benefits. So first of all, when speaking about the preventive care, there has been certain diets and vitamins that have been proven to help rheumatoid arthritis with the symptoms and the progression of the disease, such as the Mediterranean diet, vitamin D, and green tea. And the Mediterranean diet has antioxidant and anti-inflammatory effects, which help the rheumatoid arthritis development and progression, as well as improve the symptoms. And then the vitamin D has antioxidants, which diminishes the oxidative stress that is produced in rheumatoid arthritis. And finally, the green tea has anti-inflammatory and anti-fibrotic properties through the ipogallocatechin 3 gallate. And then when speaking about the patient treatment, so there has been proven that omega-3 and omega-6 intake can help with the anti-inflammatory effects, with joint pain relief, and as well as with the cardiovascular protection. And it is also important to have an adequate omega-6 to 3 ratio, since in Western diets there's usually a lot of omega-6, and by reducing this ratio, it reduces the inflammation seen in rheumatoid arthritis. And finally, the caloric restriction, which has anti-inflammatory effects, disease activity improvement, and which decreases joint pain and improves the mobility. And finally, the antioxidant properties, which can be found in vitamin D and probiotics. And now lastly, talking about the lifestyle modifications. So it has been shown that exercises helps with the symptomatic relief of rheumatoid arthritis, and it is recommended around 150 minutes of moderate intensity activity per week or 75 minutes of vigorous intensity aerobic activity, and low impact aerobic activities such as walking, swimming, and water aerobics. And it's important not to do exercise that put a lot of strain on the joints, such as high impact exercise, heavy weightlifting, strenuous or prolonged exercise, and repetitive motions such as weightlifting exercises.
Now we're going to show the protocol for multidisciplinary care in rheumatoid arthritis. A multidisciplinary care model in rheumatoid arthritis can guarantee comprehensive care with better access to all the services required to manage the disease. The first area the team includes is rheumatology. A rheumatologist will gather a complete medical history, perform a physical exam, order and review diagnostic tests, diagnose RA, develop a personalized treatment that includes a non-surgical treatment and referral to other specialists, give follow-up appointments, and research on RA advancements. Regarding the area of orthopedic surgery, an orthopedic surgeon will perform preventive surgery of deformities and destructions caused by RA in early stages and perform a surgical reconstruction of anatomic deformities caused by RA in advanced stages.
Regarding to psychology area, as psychologists are going to do activities like teach the patient to identify and manage their emotional states and the physical aspect of the disease, promote adequate coping techniques, and insist on the importance of adequate therapeutic compliance of all guidelines suggested by other specialists, and help to accept and face the disease. Regarding to nutrition area, and nutritionists are going to prepare a unique dietary guidelines for each patient based on a correct nutritional assessment according to their needs, level of affection, and objective to which they are aiming. And these professionals are going to recommend the avoidance of certain foods and recommend increase of consumption of certain foods and perform measurements of parameters in each section. Regarding to physical rehabilitation, a physical therapist are going to do a physical assessment on function, joint range of motion, and muscle strength tests. Are going to apply physiotherapy modalities like cold or hot application, electrical stimulation, and hydrotherapy. Are going to provide rehabilitation treatment techniques and educate patients on joint protection strategies, use of assistive device, and performance of therapeutic exercise.
Lastly, there's a summary of the distribution of responsibilities among staff for the management of RA. All of the members of the staff are going to be in charge of applying a medical history. The diagnosis of RA will be done by a rheumatologist and also a periodic evaluation of the disease. Surgery will be done by an orthopedic surgeon, and advice on healthy lifestyles will be done by psychologists, nutritionists, nutrologists, and physical therapists. Give medication will be a responsibility for a rheumatologist and an orthopedic surgeon. And lastly, give a follow-up on their advancement will be everyone's task. Thank you.